cost 6 lakhs. And that's not just the only cost. The running cost for this insulin pump is around 20 to 25,000 per month. How can anyone access this? Even I find it difficult, and I, occasionally use my senses because even I cannot afford it. But because I'm a new mother and I have to handle so many things by myself, taking some of the decisions away from me. I make around 180 to 200 decisions per day. And taking those decisions away from me is something that I would really want, because I already have so much on my head. But if someone is taking away those decisions, that has to be trusted like anything. That has to be safe at any cost. And when you say safe, has that been tested on us? Has clinical trials been done on us? This pump has been tested on Western, people. Their lifestyle, their body type, everything is different. Even the weather and all. I mean, when we are in Delhi and the AQI is on top of it, our blood sugar levels automatically rise and insulin doses increase like anything. And how do I trust this system when it has not been even tested on me? So I think, first of all, definitely it has to have trials on us in our country itself. I think another test to be, the way I would say it has to be safer is because, the language it uses is every time it's English or, maybe French, German, and someone who is, maybe can afford this kind of a pump or a lower version of this, but doesn't know English much well. And it actually gives me an error or, maybe alarms me. How do I interpret that is something where, safety plays a very crucial role. And I think I would really, let you also talk about what has been your experience, how challenging it has been living with multiple sclerosis, and even the stigma, misinformation, and that has doubled, tripled, especially when we are in the AI world. I cannot make a difference between what is AI developed video and what is the real truth. So back to you.
Thank you for asking me that question, Vidula. And while we are discussing health, I know I don't have to act like a teacher here in this room, but are you all aware of diabetes and multiple sclerosis? Has anyone ever heard these terms? Yeah? While diabetes is not a recognized disability in India, in the RPWD Act, multiple sclerosis is. And funnily though, the awareness still is very low. Right? Now, when I talk about my lived experience and my relationship with multiple sclerosis, it is very complicated. But I enjoy being with it because I have no other choice. So I have been living with multiple sclerosis since 12 years now. I was 20 and pursuing my chemical engineering. Very tough. But I love that subject anyways. So that was my passion, to actually do something in the field of chemical engineering, and boom, suddenly I have an episode of vision loss, which in medical terms is known as optic neuritis, which affected one of my eyes. So the vision got blurry on day 1, day 2, day 3, but because my other eye was absolutely fine, I could not make out the difference as to, is there a problem with my vision or not? And anyways, in that age, I'm very certain nobody cares. We are so young, we have so much to look forward to, that even if these instances happen to us, we don't really think about these issues as yet, until it really affects the quality of your life. It really interferes with your plans, with your goals and with your dreams. And yeah, and because of that vision loss, which stuck me while I was, and which I realized when I was crossing the road and I could not see the truck coming by, and was saved by my friend, fortunately. So, million thanks to him. That's when I realized that, okay, this is a problem. And my eye has some issue because my peripheral vision was gone, and I went to the ophthalmologist. Now, why am I sharing all of the stories? Because it is very important for all of us to also understand we're talking about digital health today, but health in general as a topic or a subject. I think it is so diverse to people. Everyone has a different understanding of health equity, health में क्या क्या होना चाहिए. क्या आप सिर्फ diagnosis की बात करते हैं? Is it just diagnosis? Is it just test? Is it just treatment? My ophthalmologist had no idea what was happening to me because I looked absolutely fine, gorgeous, and healthy, just as I look now, when I went to my doctor, my eye specialist. And while he was assessing me, he asked me if I could detect the light and all of that. When I told him that this is just what has happened with me while I was crossing the road and I could not see the truck coming by, he was shocked and he just ran certain tests. He lit a torch in front of my eye from which I could not see, just to see what is the level of my vision drop. I could not detect the light even. So he was shaken to the core. He panicked. I further panicked because I did not know that I'm bloody talking to a doctor. But then, by the grace of God, or maybe I would like to thank my stars, at least he recommended me to a neuro-ophthalmologist immediately. Right? And literally at the nick of time, at the 11th hour, I was hospitalized, put on steroids and whatnot. It is still a traumatizing experience for me, but I'm really happy that at least that was something that maybe came my way. Not everyone in our country, especially if you're talking about rural areas, are lucky enough or blessed enough to have that provision or access to at least such doctors who would know, okay, if I can't solve this problem, maybe I would refer to somebody who might. That's why I shared my journey with this. Now, again, understanding multiple sclerosis, how to navigate this whole process of accessing treatment, maybe digital health, was something which was that time a jargon to me. And I hate to admit this, even 2 years ago, till 2024, it was still a jargon. And honestly, I could not care less. Because, it is actually the harsh reality that people living with such chronic conditions like autoimmune diseases, because even MS is an autoimmune disease, people would not even bother even thinking about digital health or apps when they have so much going on in their lives already. I take a weekly injection. Every week I take an injection, which really sort of takes a toll on my entire health for 4 good days. And then after 3 days, I'm back with my injection. So when it comes to even the challenges with digital health with people living with multiple sclerosis in India, the major challenge is the awareness part also amongst our people, our audience. And of course, I would not call it ignorance, but that is, I think, the only fitting word there, that they would not care. And plus with digital health come other concepts in terms of privacy, data, right? And as I said, it scares people, especially when we talk about people in the rural countries.
Absolutely, and I think most of us over here in the room must have seen, the compliances being there for the devices or the for the applications. But what about the algorithms and the decision support systems? Do we really have a compliance for that? Are we monitoring that very well so that who takes the kind of that yes, I take the responsibility for any problems or any decisions that have been suggested by the application, the AI is my responsibility. That doesn't happen till date. And that's again a safety concern that we definitely need to focus upon at this point. So when I talk about algorithms, these algorithms again work on our data, and again how this data is being used in the future by the company or where is this data being transferred to. I think all of that needs to be understood, and informed consent is something where we are able to understand, and not the lawyers or anyone else who understands that language. So it has to be as simple as it could be. So I think that is where I see the safety part.
Yeah. I think when you mention about data part, the health systems or any health apps, they are built on, of course, this data. But then what is this data really? It is of those people who have access to care, who can reach hospitals, right? Who can have those conversations with their doctors, maybe register themselves in these hospitals. How about those who cannot, right? Now, when these health apps or systems are developed and made, it's actually being made on something which is invisible data, right? Because that data is never considered, and hence whatever systems are then built upon on this data is something which is not really inclusive, as we say, not really built on real needs of people, because they are simply assumed that it will solve a problem. In fact, with me, I have never ever used any health app, because for me it's just too much on the screen, right? I have cognitive fog, I have some days tremors and pain and tingling and numbness in my hands, and it's just so difficult to scroll through everything. That's a challenge for people with MS, and I'm sure with...
Yes. And in fact, when I talk about technology, although I feel myself privileged to have this kind of technology with me, but majority of the people do not have this at all. And even if they are using an application, mobile app or anything, they need a smartphone. In rural areas, maybe one house might have one smartphone, but that remains with the breadwinner, and that goes away. How do we input that? And do we really need this application? Yes, I think it solves a lot of problems when especially we are closely monitoring it. So if I talk about type 1 diabetes, the individual has to take at least 4 to 5 insulin injections every single day throughout their lives, and have the recommendation says 8 times is the recommended self monitoring of blood glucose every single day. First, paisa nahi hai. How do we afford insulin and strips? Even the programs that we have till now, those do not provide the basic required essentials to the patients. RBSK recently has published guidelines for screening of children living with type 1 diabetes, when we haven't screened people living with type 2 diabetes yet. More than 50, and not more than 50, but around 50% approximately have not been screened for diabetes. And I'm not talking about type 1 diabetes over here. So many children die because of this. Then there are quacks, there are stigmas around it. Insulin lete hain, don't disclose it in the public. Or insulin lete hain, we can cure your diabetes. So all of these and these misinformation, these stigmas around a medical condition, they create a big challenge to adhere to a specific routine, regime, treatment. And then when technology comes in, maybe doctor can use it, maybe their patients can use it for a while, but then how do we keep them together? How do we make them use it continuously and not just just once or twice a thing in a month, and or maybe just when before the doctor visit they are filling up all the numbers. So it's like, how do we make them use it? And that can only happen when the community is the first one to be asked.
Correct.
Okay.
Absolutely.
Like
I absolutely agree. Yes, because I think when it comes to design or accessible design, the opposite is not really the, yes, just 5 minutes. Okay. So I'll just end that sentence and maybe come to the crux. It's not really the opposite of the accessible design, or in general anything that we develop is not a bad design. I think it must include right people while developing those systems, those health apps, or any mechanisms which are actually meant for those people and not as an afterthought. So quickly, one thing, Mridula, and I think I've already spoken quite much, but how do you envision this future to be more inclusive when it comes to digital health in general and people to access it?
So the way I envision is not that difficult, but for those who are decision makers might, they feel it very hard to, work around. So why not, even before regulatory approvals, we have community approving digital intervention? Why not we go to the community, civil society organizations, NGOs, talk to them, include them from day one itself, that this is something that we are creating, maybe this can be helpful in the long go. So I think first definitely is this one. And when we talk about, the ethical part and, bringing in people on the board also, even in the clinical trials. So when we have any clinical trials, happening in our country, we must have patient partners
Absolutely.
on the board.
Yes.
So, yeah.
And frankly, I have been in advisory boards of a few pharma companies that develop clinical trials for people with MS, chronic conditions, autoimmune diseases. And I have seen them working on that part quite ethically, really passionately. But when it comes to, again, the health apps and otherwise the systems, I have not seen this getting actively done in that very spirit in which they do otherwise the health and treatment part of people living with, these conditions. And I also completely agree with you on that part, Mridula, where if we were to really have inclusive digital health, we need to, since day one, actually start with those people. It's important that pharma companies, for that matter, actually I think it makes more sense to have them as our partners as well, because they can also do the right thing, or maybe have an idea as to how do they cater to a specific community of a specific condition, or for that matter any disability, in a manner where people with those experiences are benefited directly. When they can do it for clinical trials, so can they also do it for other systems that are designed. And they are quite active stakeholders in terms of even having these systems built with the government. And I know their strength, and I think it's important that we, not just civil society organizations as such, but also we need to bring in these partners together. I'm not sure how many of you will agree with me on this, but this is my personal experience and thought that it can also benefit most or majority of the community.
Just would say that now is the time. It's not like, you pilot test everything and just, on 50 people and you say that yes, this works. It has to be a wider population. It has to have people on the board who are going to use it. And definitely the saying and, the first thing in the mind should be nothing about us without us. So I think that should be made clear in the minds of decision makers, I must say.
I think now it goes nothing without us at all. Yeah. Anything that you make.
Nothing about us
without us, yes. Yeah. So that's all, I think, from our, I don't know. But thank you for this active listening. Thank you.